Morning, people. My name is Dr. Francis Somari, the medical officer resident from City Health Hospital. I wanted us to walk through and do what we call the virtual walk. It's been a while since we did that. We'll be able to take you through the different stations that we have in our facility, and as well be able to explain the different services that we're able to come and enjoy the services that we are able to give to you, depending on the needs that you have. So we'll start off from the reception area, and we see that we have one of the receptionists by the name LT. And the reception is where it's usually what we call the information hub. That is literally the first place you will always start from. And that is in regards to what has actually brought you in, depending on the different complaints that you might be having, depending on the need. Maybe you are coming for medications, whatever the information that it is that you need. If it is booking in and all this, you always find that the first place that you start from is actually the reception. Yes, and they are very, very helpful and the same. So you're welcome, and every time that you come in, you'll find that they are well equipped to be able to give you the information that you need. We'll quickly move on. Just come with me. So you'll find that from the reception, after you've left the information desk, the next place that most of the time you'll come to is the waiting area, and we have two waiting areas in our facility. We have a smaller waiting area just before you go for the consultation, and we have a bigger waiting area. Maybe you'll have an opportunity to show that as well as you move by, where maybe as you're waiting for lab results, as you're waiting for radiological investigations and all other investigations that might be needed, you're able to see it. The other thing that maybe perhaps I'll pass on as a way of information in regards to the waiting arrangement, you'll find that we have made the provision for distancing, the social distancing. That is, of course, in regards to the issues of COVID. So we are adherent to the public health indicators, the things that we're actually supposed to be doing to make sure that each and every person that comes in is actually well taken care of. That is the waiting area. Just please come on so that we move on to the next station, that is the triage room. So this is the triage area. So you'll find that the triage area is usually manned by nurses, and you find that this is where you have the first opportunity to be able to explain. For example, if you're a patient, you'll be able to speak out on maybe what brought you to hospital. Is it that you're having a headache? Is it that you're having fevers? The different complaints as well, and you find that the nurses are also usually able to do what you call vital taking. That is the triaging. So you find that they are taking things like temperatures, they are taking things like the oxygen saturation levels, they are taking things like the blood pressure monitoring, they are taking your weight. And of course you find that the nurses are also, there are things that they handle as a service on their own. So for example, you find that we have the antenatal clinics, we also have the well child clinic, we have immunization programs, of course, for the children from the different groups. So you find that there are those things that you find that maybe you came in just specifically to be seen by the nursing department. But other than that, they also do the triage so that they're then able to push you to the other departments. Now, a lot of times you find that after you've left the triage room, of course, the next room that you come to is usually the consultation room. So we have different consultancies. We have general consultations, and then we have specialistic consultations. So we'll be able to take you through the different consultancies that we provide, but I want us to take an opportunity to first of all take you through the consultation rooms and the arrangement for the same. So you find that, just come in. So this is an example of a consultation room. You find that it is well spaced, and this is where you find that, for example, when you come for general consultation, you'll be able to talk to the doctor. You'll be able to explain yourself again in regards to what the issues that actually brought you to hospital. And you'll find that from that engagement with the doctor, then you are able to actually be given information that now will help you to find out, are you a patient that is supposed to go to the laboratory? Are you a patient that is supposed to go to the pharmacy straight? Are you a patient that is supposed to do some form of radiological investigation? Or are you a patient that is supposed to be referred to other specialistic clinics? Because you find that we also have different specialistic clinics. We have an ENT. We provide ENT services, and we maybe just we quickly take you through the ENT room that we have. Right. So we might not be able to go in as they're already having a patient, but you find that we have an ENT machine, as maybe you are able to zoom in and find, you can see that. We leave it at that because they already have a patient. But you find that that is one of the specialistic services that we provide. We also provide, just come in. We provide for what you call physiotherapy. Physiotherapy, depending on different ailments, joint, maybe you're having joint pains, you're having different complications that require the help of a physiotherapist. This is the room that we have provided for the same. It is well equipped, every machine that will be needed to ensure that by the time you are done with that particular program, that you have been nursed back to perfect health. So we also have the optical department as another department that is at a specialistic consultancy level. Just come in. Right. So this is the optical department. It is well fitted in with the state-of-the-art equipment, as you might be able to see. So you are able to have your eyes examined depending on the different complaints, whether it is persistency in headaches, whether it is that you're straining, maybe you're short-sighted, maybe you're long-sighted, different complications at the end of the day, that you find that before you are able to be told whether you need to be on glasses, whether you need different medications for different ailments that are in regards to the eyes, you need to be properly screened. We also provide glasses, as maybe you take a shot of the same. So you find that once you come in, you are able to leave the premise of the facility having gotten everything that you need that is optically related. All right. So we'll quickly move on past this department. Also want to take a minute to take you through the dental department, which is another specialistic department that we have. All right, just come in. So this is the dental department, and we have a perfectly fitted dental unit. As you can see, it's well equipped. We are able to provide for different services with each tooth extraction, filling-ins, dentures, whatever forms of corrections that are dental related that you could need. We are well able to take care of that. So you are well invited in to come. In case you have any dental needs, we are able to take care of that as well. So we'll move on past this. Now, suppose that it is that you saw a doctor from whichever department really. So maybe you came in and you saw the general physician, and from that point on you are instructed to maybe move on then to the radiology department or the laboratory department. So I want us to take an opportunity to go through the different departments in regards to the investigative side of it. So we start from the laboratory. So just quickly now. So this is our laboratory. It is graded at class F. That means you are able to provide literally any service that is laboratory related. It could be hematological based, it could be histology based, it could be biochemistry. So you find that any need that you would have in regards to all these things, you are able to come in. Of course, maybe I'll mention as a part of the season that we are in issues of it, that we also provide for those particular services. So in case there is a need for any of those particular investigations to be done, you are invited in. As you can see, we are very well equipped with the latest equipments that will ensure that you get results that are very accurate. All right, so this is the laboratory side. I want us to move to the radiology department as well. Just come. So this setup is what is called the radiology department. We have 3 different modalities that we investigate for. We have the X-ray department. Okay, as you can see, this is an X-ray machine. Again, it is the latest model in regards to that, to make sure if the investigation that is needed of you is an X-ray, we are able to provide for that. So in case if you need an X-ray, if you've been referred for an X-ray, or that is from either within or from a different facility, you can actually come in, we're able to provide for that. So we also have ultrasounds. that are able to provide for different services. Maybe it's an obstetric ultrasound scan that you need. That is for those that are pregnant. It could be that maybe you have say clots issues, so that you find that maybe what you need to have done is a Doppler ultrasound scan. So maybe we'll come, just come. But before we're able to go to the ultrasound room, maybe we'll start from the CT scan as well, because we also provide CT scan services that are able to provide the different needs that are CT related. So as you can see, we again have the state-of-the-art CT scan machine. So in case there's a head CT scan that you need, neck CT scan that you need, X-ray for the, rather CT scan of the chest, abdominal, pelvic, you name it, any part of the body that you find that you have a need that is for the investigation that has been recommended is CT related, we are able to provide that particular service. All right. So we'll quickly move on. So we have the ultrasound machine services as well. So you find that for ultrasound, I think I already made mention of what the services that we provide in regards to ultrasound are about. So in case you talk to the doctor and the doctor has instructed that what you need perhaps to get done is an ultrasound, we are able to provide for that particular service as well. So now I want us to go and have a sit down so that we can actually talk about the different perhaps modes of payment that we have in our facility, because we find that we have different provisions for the same. We find that we have those that make their payments in cash form. We have insurances on board as well, both NHIF and private insurances. So in regards to NHIF, you find that we have what we call the national scheme. That is where you find that if you're not a civil servant, you are able to actually, there's that money that usually pay out to NHIF on a month-to-month basis, either from a company that you work for or at a personal level. So you are usually put under the class of what you call the national scheme. We also have Kenya Police on board. So if you are a Kenya Police person and you have a need that perhaps requires you to be reviewed by a doctor, we are able to provide for that particular need. We also have NHIF both in regards to the civil servants for the junior scheme and the senior scheme. So you're welcome in. If you are on NHIF, please find time to pass by. We are able to assist you with whatever needs that you have in regards to that. So in regards to the other insurances per se, you find that we have UAP on board, we have CIC on board, we have Pioneer on board, we have Sunlab, we have Saham, we have First Assurance, we have MTBA as well. So you find that amongst others that perhaps have not been able to mention, but we provide for a lot of other services in regards to that. So don't feel shy, or rather feel like you cannot come to a facility based on the fact that maybe you may not have funds at hand. If you have an insurance, then just find that you are able to equally get the same services that you would. So you are invited in. Thank you for the opportunity to be able to communicate with you. We look forward to seeing you. Thank you and bye-bye.